More and more people around us are having health issues, and one of the most common is altered blood pressure. You certainly know someone who has either low or high blood pressure, don't you? Even you might have this health issue. Blood pressure is nothing more than the pumping system responsible for transporting blood through the heart and arteries and taking this blood flow to the brain and other organs. Normal blood pressure goes up to 120/80. When blood pressure differs from this number, we have hypertension, high blood pressure, over 140/90, and hypotension, low blood pressure, under 90/60. A way of differentiating between high and low blood pressure is through the symptoms. Low blood pressure makes you feel weak and faint, causes drowsiness, blurred vision, and dry mouth. High blood pressure causes double or blurry vision, ringing in the ears, heart palpitations, persistent headache, and pain in the back of the neck. So in today's video, we will talk about high blood pressure and some of the uncommon causes for it. Hypertension happens whenever there is an alteration that hinders blood flow through blood vessels. The heart needs to increase pressure to ensure blood flow, but depending on the type of hypertension, there are different causes. For example, primary hypertension. It appears within time and is harder to identify because it is not linked to health issues, medicines, or substances. It is the most common type of hypertension and is usually related to factors like genetics. Some people and families have a higher tendency to have high blood pressure. Poor eating, an unhealthy diet with lots of salt, sugar, and fried foods can cause changes that increase blood pressure. Lack of physical activity. Physical activities are necessary to maintain a healthy heart and regulate blood pressure. Besides, age also plays into blood pressure due to a decrease in the elasticity of blood vessels. This is also the reason for hypertension being more common among elders. Enjoying the video? Then give it a like and share it with your friends to help the channel. Secondary hypertension. It is rarer, but has easily identifiable causes like kidney disease, heart issues, thyroid alterations, use of certain medicines, excessive alcohol consumption, and hormonal diseases. Having high blood pressure isn't always bad and does not mean you are hypertensive. Healthy individuals commonly show a spike in blood pressure during temporary situations, such as during physical activity, pain, drinking coffee, or during a stressful event. If you feel any symptoms of high blood pressure, seek medical help. The first thing to be done is confirm the diagnosis. The doctor will run some tests to identify a possible cause, such as urine and blood tests, electrocardiograms, kidney ultrasound, or an ABPM, ambulatory blood pressure monitoring. If the diagnosis is confirmed, the doctor will prescribe a treatment and your pressure will need to be regularly measured. To do so, rest for 5 minutes. Sit down. Also, empty your bladder beforehand since the tension in this organ can cause discomfort and increase your pressure. The best way of preventing hypertension is a healthy lifestyle. Have a healthy, balanced diet with low salt, avoid being overweight, exercise regularly 3 to 5 times a week, and avoid excessive alcohol consumption. If you liked the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.